I am a clinical psychologist, and I split my time between the University of Michigan in the Department of Psychiatry and the Ann Arbor VA in their Health Services Research Group. I'm trained as a psychologist, and most of that training early on in graduate school usually involves doing experiments, often with college undergrads, very tightly controlled type experimental designs. And that was my experience up until the point in my training where I did an internship. For me, that was really an eye-opening experience because I started to see psychology not just as something that occurred in a single room, one-on-one with someone, but something that occurred throughout the health system and could have an impact in a broader way than I'd ever thought about before. Individuals with mental health problems in general and drug and alcohol problems in particular, which is one of my areas of real interest, those individuals have a hard time interacting with the healthcare system and getting high-quality care out of it. For example, if someone has a substance-related problem, they might be less likely to show up for their other mental health treatments or their other physical health treatments, or they might be less likely to do a good job of adhering to those treatments. And so, one of the things we've been interested in is how can we design the system to be more inclusive, to fit more directly and realistically with the needs that people have, and then help them receive those services in an ongoing way that keeps them connected with the healthcare system instead of leaving them feeling like that aspect of their care is isolated and not related to the other things they're doing for their broader health care. One of the topics in particular that we've become really interested in is the role that chronic pain plays in substance use and the ways in which substance use and chronic pain influence each other and might interfere with healthcare. There are also now, especially in Michigan, this is relevant, a lot of questions around cannabis and medical cannabis. There's been this growth of different clinics around the state that essentially write prescriptions for medical cannabis. It doesn't work quite like a prescription, but it kind of conceptually is similar to that. And what you end up with is an element of the healthcare system, to the extent that you think this is part of healthcare, that's completely isolated from the rest of someone's care. It raises a lot of interesting individual clinical questions, but also broader policy questions. And from a research perspective, there's a lot of opportunity to gather data and see how do all these things interrelate to predict outcomes. Do people tend to do better, tend to do worse under different circumstances? There are a lot of benefits of the Institute, and I think many of those relate to the fact that it brings people together from different disciplines and different backgrounds, even from different organizations. So I have a split appointment between the VA, hospital, and the U of M, and it brings us all here to have a single location to meet and connect with one another. Gone are the days where it was acceptable to say that, I know my treatment works because I left the room feeling good about myself and my patients seemed like they were happy. There's really an expectation now that we're able to quantify change and measure change, and that the change isn't just isolated to whatever domain we happen to be paying attention to. So if we care about the work we do and we think it has value, I think it's on our shoulders to demonstrate that and try to quantify for the health system, for payers, and for patients themselves why it is we think what we're doing matters and how we think it's making a difference.